Welcome back. We continue this morning on News and Views with myself, Salailo Makwidiri, by turning to a story that really should trouble every South African. New data shows that listen to this, nearly 1,000 children under the age of 5 have died of severe malnutrition in our public health system in 2025 alone. Cause of us finding ourselves where we currently find ourselves, with children, toddlers, babies dying of hunger. We're in a country that has, come on, South Africa has food. South Africa has resources to provide, especially for the most vulnerable in our society. But looking at that, in 2025 alone, 1,000 children under the age of 5 have died of severe malnutrition. And the most concerning part is the fact that activists are warning that the true scale of child hunger and starvation across the country could be, listen to this, 10 times higher once deaths outside hospitals are also included. I'll be speaking to activist Mark Heywood, who has been tracking child hunger and malnutrition in South Africa, and also sounding the alarm on what he calls a preventable crisis. And we'll be unpacking what the numbers really mean, why we're seeing this kind of level of loss of life, and what urgent changes he believes are needed to make sure that those numbers go low and no child in South Africa in 2025, in the most developed economy on the African continent, dies of hunger. Mark, thank you so much for joining us. Welcome to News and Views. Thank you so much for giving us your time.
Good morning, and thank you for having this discussion.
Pleasure's all ours, and I think we'll jump right into it. Let's start with the most alarming figure here. Nearly 1,000 children under the age of 5 died in hospital from malnutrition in the past year. You've suggested that the real number could be much higher when deaths outside the hospital system are counted. Just give us perspective, and why is that?
Well, in fact, it's not just speculation. It is the fact that up to 11,000 children die every year, either directly or indirectly related to malnutrition or severe acute malnutrition. They die because it's simple that there is not enough food in the household, and what food there might be does not contain enough nutrition to feed a very small and young and developing body, developing a child. And so they either die just directly of starvation, or they die of diseases are caused by permanent hunger. And as you said in your introduction, it is shocking and unnecessary and preventable because, you know, we're not in a country that is experiencing a famine. We're in a country that has a surplus every year of agricultural production. We're in a country that has a very advanced food system that is capable of moving food to every corner of the country. And frankly, many of these children, you know, die within sort of across the road from shops that have all the food that they need to be able to stay alive. So this crisis is a crisis of neglect. It's a crisis of negligence, and it's a crisis of the food system, and we have to stop it. And if I can just say one other thing, while we're talking on the numbers, you know, death is the end result. This is what happens to the worst affected children. But what we also know is that by the age of 5, nearly 29% of our children, that's 1/3 of all children, are stunted. And stunting is a medical term which refers to physical underdevelopment of the child due to not getting enough food, not getting enough nutrition. And stunting has permanent effects. It has permanent effects on the intellectual development of the child, permanent effects on the physical development of the child. So, you use very strong language at the start of this discussion, and that very strong language is entirely appropriate because this is a terrible tragedy.
And I'm just trying to understand in this context when we say malnutrition, what exactly are we referring to? You touched on it a bit, but is it moderate, acute, severe, acute? Is it a result of wasting? And how do these conditions translate into mortality statistics?
Well, it's a result of wasting. It's a result of a very small child, an infant, not getting the nutritional needs that that child's body requires for full, healthy development, for the development of their immune systems. Sometimes there may be food in the family, but the food is heavy on sugar, heavy on carbohydrates, very, very, the cheapest food that the family can afford, and it just doesn't allow the child to develop. And so children will develop diseases, diarrheal diseases, they'll develop other diseases, they will get sick, they will get weak. The parent may not recognize the problem, the parent may not be accessing healthcare services, and that it will eventually lead to the death of the child, or, as I've said, to just sustained undernutrition that causes stunting that we see in so many children.
And you mentioned numerous times that this is a crisis that can't be mitigated. From your perspective, what are the core drivers behind it? Well, what are the core drivers behind toddlers essentially dying of hunger? Is it economic pressures? Is it grant adequacy, food access, the healthcare system, or something deeper than that?
Well, in some ways, it's all of that. And that's why I think food is at the center of so many of the problems that we face in the country. If there wasn't such widespread poverty, if there wasn't such widespread unemployment and so many people with any income, then people would be able to afford the food that the family needs. So in many ways, it starts with just poverty and the social crisis. But as you've suggested, it is linked to a number of other factors. One of the things that we are challenging in the Union Against Hunger, which is a new organization that we launched last year to address these challenges, is food pricing. The big retail supermarkets, your Checkers and your Boxers and your Pick and Pays and ShopRites, are very, very profitable. In fact, they make collectively combined profits of about 20 billion rand a year. And they're profiting from essential foodstuffs by excessive pricing of essential foodstuffs that mean that poor families can't afford basic foods. And what we are saying is, look, business is business and business has to make profits. But there's a difference between making a profit on perfume or an expensive car or expensive clothing and making profits off bread or fruit and vegetables or other forms of nutritious food. And we need the government to intervene. And then combined with that, and I'm just affirming what you said, we have millions of people whose only source of income is grants, but grants have not kept up with inflation. Grants are below the food poverty line. The food poverty line is something like 600 rand a month. I mean, it's a very, very small amount, but, the social relief of distress grant is only 370 rand a month. So it's a kind of perfect storm that in many ways kind of epitomizes the equality crisis that we have in our country, but it's the most tragic manifestation of that crisis.
No, most definitely. Just I want to get because it's so mind-boggling for me. What is the government saying? their response in your engagements with the relevant authorities? How have they responded to these figures? Is there urgency? Is there acknowledgement, or restructuring policy, or any kind of a response that you would expect from a government of the most developed economy on the African continent?
No, bluntly. I mean, certainly there's acknowledgement. Nobody is disputing these figures. Nobody said that it's not true that there are 11,000 kids dying every year, 1,000 directly due to severe acute malnutrition. So nobody's denying the problem, but there's no urgency to deal with the problem. If I was the president, or if I was the Minister of Health or the Minister of Agriculture, then I would summon a crisis meeting and I would say to various cabinet ministers, come up with a plan to end child malnutrition. I would tell the Minister of Health to roll out a program to proactively identify households where there is food insecurity and where children are not getting enough food, to go and, because acute malnutrition, it's a medical term, it's literally physically measured in children. Go and identify those vulnerable children. Then I would tell the Minister of Agriculture or the Minister of Trade and Industry that you need to convene the big retail chains and ask them what they're going to do to address this problem. And if they're not going to address it sufficiently, you tell them that we are going to regulate prices on essential foodstuffs, because the government has the power to do that. It can intervene in markets where it's failing. So it's just one more, I believe, kind of indicator that our country doesn't value life equally. That, if you're a child, if you're extremely poor, if you're largely invisible, then you will suffer in silence. And that's why we need to have discussions like you and I are having. We've got to speak out about this type of thing, because it's not, I mean, it's horrible, that's all.
Yeah, it definitely is. It definitely is. I'm trying to look for positives here. Are there any promising local programs or interventions that are showing any kind of measurable impact that could be maybe scaled up? And what role is civil society and maybe community organizations playing in responding to this crisis? And are there any spaces where they've proved to be most effective?
Yeah, that's a great question. So what I would say is the positive is that if it was not for community organizations and community kitchens and civil society, this problem would be much worse. Civil society everywhere is rising up and trying to meet the needs of hungry families, and they need more support. They need much more support than they are getting. And then there are interventions which, if they were scaled up, could literally save thousands of lives and improve the lives of children generally. In the Western Cape at the moment, there's a pilot program that is identifying pregnant mums or to-be mums who are not getting sufficient food, and introducing access to vouchers for those mums to make sure that they are able to get their food and nutritional needs, and for the child after birth. So there are plenty. I think there are plenty of good interventions that show that we can make a difference, but we need interventions at scale. We've demonstrated proof of concept, if you like, but we need to go to scale if we're to really make an impact on the problem.
Most definitely, Mark. I think going to leave there for now. Thank you so much for giving us insight on a very, very worrying turn of events. As I mentioned before, you wouldn't expect these stats to be coming out of South Africa, a country that is, as you mentioned, has surplus in agriculture, can provide food, and we know the stats and the numbers of food wastage in the country also. While you have toddlers and children dying of hunger, it's very, very concerning.
Thank you, and thank you, as I said, for having this discussion this morning. And I'd appeal to listeners to, to take this, find ways of taking this issue up and working in communities that we come from to support NGOs and CBOs that are working on food. But also, we have local government elections coming at the end of this year. We need to make food security, access to food, access to land, access to support systems for informal traders who can bring fresh fruit and vegetables close to the community at more affordable prices. We have to make food a political issue in government, not a party political issue, just a political issue. We need this issue to be addressed properly.
They have it, Mark Heywood. Thank you so much. Drawing the line there and attention to a hunger crisis that many South Africans might hear about, but I think only few truly grasp until they feel it in their own communities. And I think more needs to be done. And not in 2025 South Africa, a country that prides itself on taking care of the most vulnerable in our communities, a country that has a surplus in agriculture, food wastage is at an all-time high, but you have children, babies, dying of hunger, and in a country like ours, relatively peaceful, there's no political instability, civil war, or any kind of natural disaster, but something like this is happening. Childhood starvation in South Africa, 2025. If that doesn't get you to act and do something about the state of our country, then I don't think anything will. We're going to take a quick break. When we come back, News and Views continues.